Right. Well, about 2 years ago, I decided to use a bequest from my mother, Martha Redlich Hutchison, to fund an artist in residence because I felt it was important to educate the public about what is possible with modern facial surgery and what isn't possible with modern facial surgery. Midway through the project, I realized that Mark's paintings could be used to illustrate for the general public what charity needs to do for facial surgery, because the problem is that oral and facial diseases are very, very poorly funded. Research into them is if we take mouth cancer, for instance, and compare that with cervical cancer, mouth cancer is as common as cervical cancer in women. It receives less than 1/10 of the funding for research as cervical cancer, and it's more disfiguring, more lethal, more mutilating. And what I wanted to do was set up a charity which could fund research into facial diseases and facial injuries, their prevention and their treatment. So we have several projects. We have a group of 38 surgeons throughout the United Kingdom who are committed to funding research into mouth cancer and need administrative backup. They need people to run the studies, to run the research, to improve the treatment. We've got campaigns that we want to run on facial injuries. There are 1 million people who come into casualties each year with facial injuries. If everybody out there spends £1 on, if 1 million people spend £1 into our charity, then we'll be able to fund that research trying to prevent facial injuries.
Mark Gilbert, you have been painting, what, is it 20 people you've been painting over the past year?
Yes, that's right.
Now this gentleman here is one of the people you've painted. Tell us about him.
This is Henry, who is a barrister who has had umpteen operations over the last 10 or 12 years. He was the first patient that I worked with almost a year ago, and I've done numerous paintings of him at different stages of his treatment, and also a series of paintings, large paintings of close-ups of his surgery, of the actual operations. And over time with Henry, as with all the patients, I've managed to build up a good relationship with them. I've become close friends to them, and hopefully that relationship has then informed the paintings, and also the fact that I've witnessed, you know, very sort of sensitive and areas of the treatment like this surgery has all come together and hopefully informed the paintings and made them sort of informative and hopefully richer.
I mean, I suppose any sort of damage to the face is particularly damaging psychologically to people. Have you found that it has made it easier for a lot of the people you've painted, for example, to come to terms with the injuries they have?
Absolutely. I mean, when I set up the Artist Project, which is now informing the charity, I set it up to educate the public about what facial surgery was about, to educate the public that somebody who has what appears to be a facial disfigurement is a normal, fulfilled person. I think you can see from this portrait, here is Henry, totally at ease with himself, powerful, strong. He's windsurfing, he's still performing in court. It doesn't interfere with his life at all. And also, what we found was, what I thought we would find, and what we have found, is that the art is cathartic. Seeing themselves portrayed in paint rather than in a photograph allows them to see their personality. You can see
Why
Henry's
is that easier to look at? It's less stark, it's less right there in front of you?
I think so. We've now employed a psychologist, which is another thing that I want the charity to do, to employ a psychologist to look at how surgery affects people. And what the psychologist tells us, having studied these patients, is that they've learnt to be strong, and these portraits help them look at themselves and define themselves as people much better than photographs can.
Mark, what have you found over the past year? Have you found that there's been some sort of change in the people you've been painting and the way that they perhaps face their own disfigurement?
Yeah, I mean, I think at the very least, hopefully it's been a very enjoyable experience for them, but I think it's even, in some cases, it's very tangible. I've heard patients say that they find it difficult to look at photographs, and yet they look at the paintings and see them as positive images. It's also educating the patient as to what's happened to them in theatres. So, I mean, it's unique that any patient would ever see any kind of visual record of their operation, or any visual record if the patient has still to have their operation. I can then relate maybe some of the paintings I've already done to the process that they're about to go through. And this seemed to be a very positive aspect to it as well.
I mean, your painting here of Henry, it certainly is a very powerful image. What do you hope to do with the paintings? Will they be put on display?
We're having a press launch of the paintings and the charity on Wednesday, because the two go hand in hand. If you like, I'm the founder of the paintings and of the charity. And then they will go on a national tour for 3 years, returning to the National Portrait Gallery in spring 2002.
How do people feel about this being shown in public?
Well, we asked the patients. We had to go through ethical hoops beforehand. 6 months it took to set the project up, to go through our ethics committee of Barts in London to get their approval. And patients